I'm pleased to welcome the CEO of IDT Australia, Paul MacLeman, to the Morgans Network. Paul, can I start off by asking about IDT and just tell us briefly what the company does?
So IDT is a long-established manufacturer of high-potency pharmaceutical ingredients and finished dose forms. So we manufacture both the powder and then the tablets and capsules that get made out of that powder. Historically, we've been a manufacturer for other people, so a contract manufacturing organisation, but we're just in the process now of transitioning to a pharmaceutical, especially for generics pharmaceutical company in our own right. And we also own a large clinical unit in Adelaide called CMAX. It's Australia's largest and most well-established clinical trials unit.
Okay, so that core business, which you've just described, has been showing very strong revenue growth. How sustainable is that into the future?
Yeah, so we talked at a recent conference about quite strong growth, 60% growth year on year on the Melbourne site last year, and that was with a very minimal to no increase in cost, which was very pleasing. We sort of measure our run forward on that business on the basis of a sales pipeline, and that's been improving steadily over my tenure of the last 2.5 years. So when I started, that sales pipeline was sitting at about 7 million, and today it's sitting sort of north of 40 million and continues to head in the right direction on a sustainable basis. So we're reasonably confident that that growth is going to continue and that we can maintain that improvement in those contracting revenues.
Okay, and IDT has recently bought a basket of generic products from a US company. Can you talk us through the approval process and how those products will be distributed?
Yeah, so we bought 23 already FDA approved generic products for the US market. What will actually need to happen is what's called a site transfer, so it would be analogous to a company moving them from one of their own sites to another internally. We're just moving them from the other site onto our site in Australia, which is already FDA approved. So depending on the status of the dossier, what sort of shape it's in and how old it is, it'll go through either one of two processes, one of which will take sort of 3 months from the time we start working on the molecule, plus an approvals time after that at FDA of about 30 days. And then the other process takes a bit longer. It could take up to 6 to 8 months, and for the first 1 or 2 anyway, may require an FDA inspection.
Right, okay. So when we talk to investors about investing in a number of these emerging healthcare names, we always talk about key milestones. So could you tell us what we can expect from IDT over the next 6 to 12 months in terms of milestones?
Yeah, so again, touching on those 23 products, we're working towards getting the first of those back on market through the course of calendar 16. We're hopeful, it's not definite yet, but we're hopeful we could even get some back on market in the first half of the year. But certainly we would see some of those products coming through the course of the calendar year. As you alluded to before, the strong growth in our revenues means we're also trending closer to profitability, so we're anticipating an improvement year on year in both revenues and bottom line next year going forward. And indeed, over and above that, a marked improvement in cash, because we'll have a number of milestones coming through from the transactions that we've been doing recently for the distribution deals. Mm-hmm. On top of that, we have a further drug coming through FDA, generic brain cancer drug called temozolomide that we filed in late 2013, and there's a possibility that that may reach market in the late part of calendar 16 as well. And as people would have seen, we've got an arrangement for distribution for that product with Main Pharma.
Okay. And I might just finally touch on your distribution partner in the US. You've recently signed up a group that's very aggressive and innovative over in the US market?
Yeah, so we've formed a relationship with a group in Minnesota called ANI Pharmaceuticals. They have 2 plants in the north part of the state of Minnesota and distribution capability in New Jersey. Yes, they're actively entering the market with their own cohorts of products, and now assisting us to get our products back through to market as well. So we're anticipating that we'll manufacture most of the products at our Melbourne facility. A couple of the bulkier products that we're not quite so well set up to handle, they may take into their facility in North Minnesota, but we're anticipating a really good relationship with them. They're nice folks. Okay,
terrific. We might leave it there. Paul, thank you very much for joining the Morgans Network, and good luck for the next 12 months.
Thanks, Scotty.